All right, so continuing on with the. All right, so let's talk about the spine more specifically. So the spine itself is made up of 26 vertebrae as an adult. You have 7 cervical vertebrae. There we go. You have 12 thoracic vertebrae, 5 lumbar vertebrae, 1 sacrum, and 1 coccyx. When you're a child and through development, those are separate bones. Okay, so when you see larger numbers, like you'll see 33, that represents the vertebrae as if you have all 26, plus your sacrum are still individual bones, plus your coccygeal bones are all individual bones. The sacrum, I should point out, is not fused to the lumbar vertebrae or to the coccyx. It's just fused to each other. So each one of your vertebrae you think of as normally are very quite separate. You think of the sacrum as fused. It's not fused to anything around it, just within itself. This is a completely midline structure, as I mentioned in the last video, and it forms joints with the occipital bone superiorly, so right up here by C1. It forms joints with the ribs, and that's all of your thoracic vertebrae. You have one basically for each rib. And with your pelvis is going to form joints on either side of the sacrum largely. Between each of your vertebrae, you have an intervertebral disc. So the bodies of your vertebrae are not just stacked directly on top of one another. That would be bad. That would lose flexibility, and you also wouldn't have any kind of shock absorption with impacts that go up the spine. So every step that you take, that's an impact, and that's going to send a bit of a shock wave of energy up through your body. If your vertebrae are all directly touching, it's all just going to completely go from one to the next. If you have an intervertebral disc, it's like a pillow, it's going to absorb a lot of that. So even though the further up you go in the body, the smaller the vertebrae, you're also getting less of that impact. And its main function, aside from being this midline anchoring structure and what's going to provide our entire axial skeleton a great deal of flexibility and movement, it also protects the spinal cord. Inside of the vertebrae, your spinal cord is going to run through the entire length of it. The blood supply to your vertebrae come from a variety of sources, almost all of which are all of them are fairly direct offshoots of the aorta. And we'll see that each individual vertebrae then has its own separate branches off of these that sort of encircle the body of the vertebrae, as well as feed the periosteum and take care of the arch of the vertebrae as well. So the major arteries that supply the bones of the spine are the vertebral artery, comes right up here, and it's sort of blue is sort of maybe a bad choice, but we're just talking about arteries here. These go up through the foramina along the side of the cervical vertebrae. We also have our ascending cervical artery on either side, which is a branch of the subclavian. We have the posterior intercostals, arteries, and these are branches directly off of like that long trunk of the aorta that you think of that kind of go off one to each rib, but it also feeds that part of the spine as well. We have subcostal artery, the lumbar artery, the iliolumbar, median sacral, and the lateral sacral. From there, like I said, you have sub-branches. So here you can see this, whoops, let me erase all of that other flotsam here real quick. You can see that for any given major branch that's serving the vertebrae, you have these smaller branches that come and sort of hug the actual bone itself. So here is sort of your main feeding artery. Could be the vertebral. Well, in this case, it's not going to be the vertebral artery. It's probably going to be something more like the posterior intercostals or the subcostal or something. And from here, you have equatorial branches that are going to kind of encircle the body of the vertebrae. You have spinal branches. These are ones that kind of come in and are going to hug to the spinal cord. That's sort of an exaggeration so that it stands out over there. It actually goes around the spinal cord, as well as the anterior aspect of the arch of the vertebrae. And then you have the periosteal branches, which are these sort of penetrating branches that come in periosteal arteries, and these here are spinal branches of those. From there, you also have vertebral branches coming off of the equatorial branches and the spinal branches that go up across the spine and down along the spine as well. These are ascending and descending branches. Here you can see, once I get rid of all my chicken scratch, you can see those blood vessels. So see, you've got coming up, like here's your major blood vessel, and then you've got some that are kind of coming up and others that are going to kind of snake down as well. So we already talked a little bit about the regions of the spine. You have 7 cervical vertebrae, you have 12 thoracic vertebrae, 1 for each rib, you have 5 lumbar, and strictly speaking, 1 sacrum for all intents and purposes. You can see how in earlier development, those are still pretty separate bones, and so that's where you start to get that 33 number from, is when those are separated and your coccygeal bones are separated too. But in adults, they're functionally fused. And by the time you're even a teenager, they are largely functionally fused as well. So let me actually just change the color of this a little bit. All right, so when you start off in the womb, you don't really have any curvatures. You have this just sort of big bow shape to your spine. And that makes sense because, like, what do you need to do really, right? Your spine is a functional thing. It's designed, quote unquote, designed to do a number of specific tasks, all of which have to do with you moving around in the world in opposition to gravity. And if you're a fetus bobbing around happily in amniotic fluid, completely supported, you don't need anything. So you're good. You're a curve, one big curve. By the time you are about 6 months in gestation, you start to develop a little bit of a curve in a couple places near your sacrum and then up around your upper thoracic and lower cervical vertebrae. And this has a lot to do with just your spatial constraints. You can see that you've lost some of that when you're a newborn, as your spine is pretty straight throughout the whole thing. Down towards the bottom, you are developing a little bit of a lumbosacral curvature though. Now, by the time you're 4, you have what's sort of the beginning of an adult looking curve. You have this concave cervical curvature, to exaggerate that. You have a convex thoracic curvature, a concave lumbar, and you're still sort of a concave sacral, but that's going to become more like the adult kind by the time you're a teenager. Now, in between here and here, a lot of stuff happens, right, between newborn and 4-year-old. And a lot of these curvatures are going to really start to firmly develop in that first year of life or so. So the spinal curvatures are going to develop based on the stresses that your spine is put under. When you are a couple months old and you're starting to learn how to lift your head up, you're making those muscles stronger and stronger to be able to concave, to sort of hyperextend your cervical spine there to lift your head up off the floor. You're developing a cervical curvature with that motion. As you start to stand up, you really need to have a little bit more of a bowing out here and a little bit of a bowing in here, as well as the bowing in up here, this concave, convex, concave sort of pattern, to be able to support your weight upright and to help you keep your balance. If you think about how well a rod stands straight up on its own and how easy that is to tip over versus something more like a spring, you have, and that's exaggerated, but you have a better idea as to why it helps to not have this ramrod straight spine. The other reason that you need to have these curvatures is, I mean, it really does kind of just act like a spring for you. It helps you absorb and distribute stress. So whenever you're taking a step, you're going to have the impact of that step going straight up your spine like that. And if your spine is in fact shaped like that, all of it is going to be completely absorbed by all of the bodies of your vertebrae straight up. Now you do have those intervertebral discs that help sort of pillow cushion in between, but that's where the force is still going, and it's going to be able to travel way higher up your spine than it would otherwise. This helps you distribute stress. It helps you absorb some of the stress from any given step. And in addition, it helps you improve your overall flexibility. So you have a greater range of motion permitted by having this curve. And you also are able, like I said, to maintain your balance better. When these curves become exaggerated or misaligned, it leads to spinal curvature disorders. So let's look at that on the next slide. So all of these abnormal curvatures are going to result in some combination of issues with your mobility, your flexibility, how well your spine absorbs stress and prevents it from being distributed to other bones that it's attached to, how well you can keep your balance, things like that. And all of these can come from a variety of sources. So they could be inborn, they could just be from a genetic sort of a cause. They could be due to neuromuscular conditions like muscular dystrophy, for example, that can affect your muscle control and strength, and that might help misalign the curvatures of your spine. They can be the result of injury. So you could be born and be a kid with a totally normal, straight, curved, spine, and then it becomes off because of some sort of injury. It can be because of degenerative changes. So this kyphosis for here, for example, is what you think of as like old lady hunchback, right? In this case, the injury isn't, and the degeneration isn't really because of an impact. It's because you're losing calcium and the bodies of your vertebra through here start to crumble. And as they crumble, they go from having this sort of an alignment to having more of like, more sort of like this alignment, where you end up with this, and that's backwards, but you end up with this wonky sort of hyper exaggerated shape. I'll point out right now though that even in a quote unquote normally straight spine, you have lordosis, which is this sort of concave curve, kyphosis, which is this hyperconvex curve. But this natural curvature goes by those same names too. So if you could say that somebody might have an appropriately lordosed cervical spine. That's not pathological, that's just describing the shape of their cervical spine. So kyphosis has a lot to do with that sometimes. It can also be, frankly, and I know that like your mom told you this and then you were told that it wasn't a thing, and now I'm going to tell you it is a thing, that your mom was right. It can be a result slightly of poor posture. Same thing with lordosis, and that's partly just because of the musculature influence on the shape of your back. So sit up straight. I know you're all hunched over your laptop right now. Sit up straight, shoulders back a little bit. You're going to feel better long term. You're going to look better too by just having a nicer posture. Anyway, so kyphosis is a sort of like hunchback that you see. Lordosis is what's often called swayback. So you end up with this like exaggerated concave curvature in the lower spine. This could be genetic, it could be from neuromuscular conditions, it could be from injury, but the way you see it, at least as often as not, is as a result of pregnancy. So when your center of gravity kind of starts to go more like here instead of like here, your back is going to want to compensate for that to help you keep your balance, and it's going to become additionally like extra lordosed. That can often go back to normal once you no longer have that child, or it could stay in place after you've had your child. And if it stays in place, that can cause pain, and it can cause chronic injury by just keeping it like that for a long time. Scoliosis is where the spine is not strictly a midline structure, but it has a little bit of a side-to-side sway to it. If you have scoliosis, you're going to need to have some sort of a corrective action, ideally earlier in life. If you catch it earlier in life, it's usually correctable just with sort of physical therapy style interventions. If you catch it later in life, you may need something a lot more intense. And you should keep in mind that a lot of us have a little bit of scoliosis. Like, we're all biological beings, right? And nothing is perfectly straight, nothing is perfectly centered, nothing is perfectly symmetrical. There's always a little bit of off. So there is some amount of scoliosis you can have where it's not a problem. Okay, in which case you're not going to be diagnosed with anything, but you may notice it if you sort of run your hand up and down someone's spine that's not perfectly straight. That can be totally okay. It's only once it starts to get exaggerated to the point where it starts to interfere with your ability to function that you really have to start worrying about it.